The information in this video is provided for informational and educational purposes only. Hey everybody, welcome to another edition of the Morale Monologue. My name is Michael Morale. Okay guys, in today's video, I want to talk to you about a procedure that I went through last week with my physical therapist, Emily. You know, I've been doing videos about the benefits of physical therapy for those of us with SMA for quite a few years now. And I do this because I see how important physical therapy can be for those of us with SMA that sit in our wheelchairs for the majority of the day. You know, we don't have the ability to get up and stretch. We don't have the ability to get up and relieve the pressure that we have on our tailbones and other areas of our body. And the video that I did today talks about 3 different techniques that I've gone through over the past year with Emily to adjust my tailbone, otherwise known as a coccyx bone. Now, I've linked Emily's entire article in the description of my video, so please make sure that you go down and click on the link and read the entire article for yourself. I'm going to be going over just these 3 different procedures, but her article also gives some great information that you and your family and even your doctors may find useful. So take a look at the video and then I'll come back and I'll give you my final thoughts. Thank you. The first technique we utilized was the stuck drawer technique. This is performed by sitting with one hand under the patient on the coccyx while the patient performs lumbar flexion and extension and tightening of the pelvic floor to help with mobilization. Since Michael doesn't have full active range of motion of his lumbar spine, this requires a second person to lead him through these motions while the other is mobilizing the coccyx externally. This technique gave Michael a moderate amount of relief while sitting and reducing tingling and numbness that radiated down his leg. This was performed every other week to maintain the effects. The second technique performed was a sideline external coccyx mobilization with activation of the pelvic floor, performed to increase coccyx movement. This was performed on a large therapy mat with Michael lying on his left side with support between his legs and under his head. As I would add traction superiorly toward Michael's head, he would relax, and as I would apply traction inferiorly toward his feet, he would perform a pelvic floor activation. In this position, I also began to target coccygeus musculatures, or muscles along the coccyx, and began to release them on the left side, as Michael's coccyx tends to migrate toward that side. With this technique, he felt a substantial amount of relief from numbness in his legs and pressure on his tailbone. The most recent technique we have performed has been an internal coccyx mobilization. This was performed with Michael lying on his side with support between his knees and under his head. With permission, one finger was inserted into the rectal canal and the coccyx was located. While Michael performed pelvic floor activation contractions and bulging, I was able to locate and feel how the coccyx was moving. A soft tissue mobilization called sweeping was performed along the left coccygeus musculature alongside the coccyx to release those tissues and attempt to bring the coccyx more into midline. We are unsure of the longevity of the relief with this technique due to how recently it was performed, although Michael had no pain after the activity. Depending on how much relief Michael receives from these activities will determine which ones we perform and how often they are needed. We will continue to monitor and keep track of the time frame of relief experienced with each activity. This will help guide our future treatments and treatment plans. I've said numerous times in previous articles and videos that the patient and physical therapist relationship must be one of trust. Emily and I have been working together for more than 5 years, and she has a unique way of making me feel comfortable with the therapies that we're doing. SMA patients should realize that certain techniques may be uncomfortable to undergo from a vanity standpoint, so trusting your physical therapist is crucial. Emily knows more about me than the majority of my immediate family and friends, and there was no hesitation with me agreeing to let her perform this technique because I knew she had my best interest at heart. Okay, so I hope you enjoyed the video, and I hope you got some information out of it that you can use as well. We at SMA News Today strive each and every day to bring you information that can help you lead a better life, and we hope and pray that we're doing a good job. If you enjoyed this episode of the Morale Monologue, please give me a thumbs up, and don't forget to subscribe to the SMA News Today YouTube channel as well. We would greatly appreciate it. Remember, when you do subscribe to the channel, be sure to click on the bell icon. That way, you'll be notified of any new videos that we do. We at SMA News Today hope all of you have had a great day. Do me a favor, this upcoming week, do something for yourself that's going to make you a better person. Until next time, take care of yourself, and I'll talk to you in a couple of weeks. Bye-bye.